Cap Energy launches the first urological and andrological tecartherapy equipment with a medical CE certificate for the treatment of erectile dysfunction. The great importance of this invention is the fact that it is the first certified device that fills the current gap between drug treatment and psychotherapy. Until now, there was no clear technological solution that offered an effective therapeutic response to this pathology that affects 20% of the male population. Thanks to this innovative option, the patient has a scientifically endorsed treatment element certified by the health authorities to effectively treat their pathologies. Let's see how it does it. First of all, it is important to know that this device uses a very specific therapeutic target and that it has proven to be the most effective at the moment. This is the endogenous vascularization that produces electromagnetic energy. Through a mechanism of pulsing afferent and deferential arterial blood of the capillaries surrounding the penis and of the large arteries and veins of the pelvic region, a deep circulatory stimulus is produced and erection occurs. This mechanism is also linked to the increase in nitrous oxide, which is proven to play a decisive role in the process. Well, now Cap Energy has combined these two therapeutic targets into a single device on the market that allows maximum therapeutic intensity and efficacy to be achieved. This is how the C25-man urological tecartherapy device was born. The C25-man equipment is a certified medical device that is indicated for the treatment of erectile dysfunction. This treatment is performed through the application of an automatic external orthosis specifically designed to treat the strategic points of the male genital apparatus that is applied as if it were the patient's underwear. Through this patented application system, the patient has a treatment element that allows him to treat his dysfunction, even taking medication from other pathologies that could have a negative effect on his sexual life. This is the case of antihypertensive cardiac and antidepressant drugs. In cases where the medication is for life, the use of the C25-man constitutes a great ally in the face of a recurring and inevitable problem. Another group that suffers from this disorder is the diabetic patient, who sees, along with other consequences inherent to this disease, how his sexual life also decays. The C25-man device can also treat two additional pathologies. First, Peyronie disease. This disorder occurs when there is fibrosis in the penis. By incorporating optional external accessories, capacitive and resistive, to the C25 equipment, it is also possible to approach this pathology by applying these electrodes through a massage on the affective area. Second, incontinence can also be treated if the patient has undergone a radical prostatectomy. When this occurs after prostate cancer, many patients observe how their ability to retain urine is compromised. In these cases, this device allows the optional attachment of a resistive intercavitary probe to treat the pelvic floor through the rectum. These two additional components make the C25-man equipment a highly effective device in the treatment of male pathologies. Pain. The C25-man device also treats chronic pelvic pain. The effectiveness rate in the treatment of pain with this device is high. Already from the first session, 85% of treated patients say they reduced their pain by 75%. As the studies carried out by recognized hospitals and researchers reveal, the results leave no doubt that there is before and after in the technology with the invention of this device. This technology finally offers quality results in short times. In addition to the quality of care, the C25-man stands out for being painless, having no negative side effects, and for being an operational and profitable working instrument for the professional. Thanks to its use with a disposable hygienic plastic that is placed between the orthosis and the skin, the treatment is economical for the patient. He does not have to buy a specific orthosis himself for hygiene reasons, but only use a protective cover of the orthosis that fulfills a hygienic function and that is opened in front of him. This guarantees the hygiene of the treatment and prevents any type of infection. Let's know now what some of the professionals who already use this technology think. In short, the Cap Energy 25-man urological tecartherapy device fills the gap that currently exists in the treatment of the pelvic floor and numerous urological pathologies, among which, without a doubt, erectile dysfunction. Until now, one could only opt for a pharmacological or psychotherapeutic approach, or basic accessories with little scientific evidence when this dysfunction was diagnosed. And in addition, it is inevitable when the patient must continue to consume certain medications for life because of having other associated diseases. Thanks to this important technological innovation, a quality result can be obtained, scientifically endorsed and certified by the health authorities through a simple, safe, hygienic, efficient and economical procedure for both the operator and the patient. Many professionals have already contrasted it, and thousands of patients have benefited. Know all the benefits that the C25 MAN device has to offer. Cap Energy, at the forefront of urological technology.